I really believe firmly if you go through the entire 30-day program, which is going to be very rare, I expect no more than half of the dental offices to go through all 30 days. But if you do it, if you're hungry enough and you want it, you're going to have all the tools at the end of this 30-day Dental MBA to take your office to any level you want to be. Healthcare is not an expense. It is a thriving industry. It is 1/7 of your economy. And I'm telling you, the best thing in the world you could help for is that economy grows in double digits, because the United States has been slumping along at 3 to 4% for the last 25 years, and healthcare is growing up. It's the only thing that beats inflation every year. It's the healthiest sector of your economy. If I divided the dental offices in America, 161,000 dentists and about 136,000 offices, if I divided them and say I want everybody to get in two groups. One group is a dental office that has all their chairs full every day at least once. That's an assembly line, no capacity. Then I want everybody to stand on the right side who can go 2 out of every 3 days with an empty dental chair. I divide those people, I average up all their incomes. The persons that have a dental chair that no one ever sat in 2 out of every 3 days on the aggregate nets $70,000 a year more net income than the group that has all their chairs going once a day. Why? Because when you're in assembly line where all your dental chairs are filled up and Mrs. Jones is in there getting a cleaning and you tell her she has a cavity and she says, "Gee, doctor, is there any way you can fill that today?" And you say, "No, I'm sorry, all of our chairs are filled, so no, I can't accept your money today. I'm too busy doing fillings for a lower price than to have any open capacity to even offer you the chance to get it done today for $1 more." And so capacity is everything about expenditures, it's everything about a growing economy. And the minute your receptionist starts telling people who phone in, "No, I'm sorry, I can't take your money today. You'll have to wait a couple days to come give us money." Now take that behavior and go to any other business. If you walk onto a car lot, you could buy a $40,000 car right now. You could go buy a $150,000 2-seat Mercedes-Benz 5-stack CD in the trunk within 30 minutes. You could go buy a Suburban, a new car. You got to think about what you can't buy today in America. You get into a movie, unless it's just Friday night opening. You could get into, hell, you could have a hooker and a pizza delivered in 30 minutes in this country. You can get anything you want in 30 minutes or less, except for a medical or dental appointment, where you've got to wait 2 or 3 weeks and stand in line while the doctors try to learn a little bit about economics. When people talk about what about the rising cost, the number rising of people without health insurance, that's because doctors are not doing market segmentation. When you got all the doctors making a Cadillac and no one wants to go make a Ford Escort, that is the only reason why health insurance is unaffordable, because you got 95% of all the doctors and dentists chasing the top 5% wealth of America. And the number one problem with healthcare in the United States is that basically you have no market segmentation. Everybody's trying to make a Cadillac or a Buick. No one will go in downtown, just open up a dental clinic where they just pull teeth, do silver fillings, and make dentures and partials. And if you did that in every aspect of healthcare, where you had maybe one hospital that just does basic healthcare and they could sell insurance, make it cheap. They don't do cardiac catheterizations. They don't do heart, lung, and liver transplants. They just do basic healthcare. And if the state boards would say, well, are you a dental office, a medical office, or are you a dental clinic or a medical clinic, and have 2 sets of statutes. These are the laws, and this is the standard of care for a hospital office. This is the laws and the rules with more expanded function and more leeway for hospital clinics. Maybe in a hospital you couldn't draw blood unless you're a phlebotomist, or clean teeth unless you're a hygienist. But in a dental clinic or a medical clinic, if the nurse's assistant, if the doctor gave her permission to go draw blood, she could do it without being a phlebotomist. If the dentist gave Jill the permission to clean teeth because he trained her as an apprenticeship to clean teeth, she could clean teeth without being a dental hygienist. Until you implement market segmentation, you will always have 43.4 million as of 1997 who don't have health insurance, and the reason they don't is because it's not affordable, because you don't have market segmentation.
Howard's timeless 30-day MBA series from 1999 presents strategies used in making economic decisions that have already been beta tested in his own $2 million a year practice. To order, call 480-445-9712 or go to www.dentaltown.com/one-day MBA.